Morning everybody, and thank you to the organisers for having me here today. As Kate said, I am going to give an overview of some aspects of social participation among middle-aged men in Ireland. I must admit, this week was the first week I've considered myself middle-aged, when I say 40 to 59. And I say that because I have to give the caveat of in TILDA we only recruit from the age of 50 onwards, so it'll be that age group that I will focus on. I suppose in general terms, and hopefully this will provide some context for speakers later on today, social participation, whether formal or informal, is a really key aspect of successful ageing, and I hope to demonstrate that for you today. So in terms of my presentation then, I'll just provide a brief overview or introduction to the Irish Longitudinal study of ageing, for those of you who aren't particularly familiar with it. I'll then describe the percentages of middle-aged adults who participate in formal and informal social activities. In particular, I'm going to look at volunteering and in active and social participation, which I'll describe in greater detail shortly. I will look at change, and I have my by two here. There's probably two ways we can kind of use TILDA data to look at change. The first is to look at differences between cohorts, and by that I mean comparing this middle-aged group with an older age group. And secondly then is to look at it longitudinally, so look at the middle-aged group as they age over time. We're quite limited so far in that second aspect, and that there's only 3 waves of data available today, which gives us only a 4-year time gap. So obviously there's not that much change happens in that period, but I will point to some work that we'll be completing at the end of this year, where we introduce the 4th wave and then subsequent waves, which should give us a better a clearer picture at that stage of transitions over time among this group. Importantly, okay, it's fine to say, these men are more participate more than these, but I hope to show as well some of the benefits of those, which should feed into later talks as well. Okay, so very briefly on the Irish Longitudinal study of ageing. So TILDA was motivated largely by the fact that the population is ageing. Right? People are living longer, and as a society, and I suppose in terms of public policy, it's important that we do what we can to try and ensure that those extra years are enjoyable and people still enjoy their lives, and it isn't all about disability and functional limitations and so on. So with that in mind, TILDA takes a very holistic view of ageing. So we collect information on a wide range of domains, so everything from health, social participation, family structures, employment, and also physical health assessments, which help us bring those, bring the biological and the social together, as it were. So in the first wave of TILDA, we had 8,500 participants, and as I said at the outset, the youngest participants are age 50. So when I'm talking about middle age here, I have to redefine it for today's purposes to 50 to 59. We collect data at every 2 years. So at the moment, we're just getting ready to go into the field for the 5th wave. So that will give us a great 8-year period over which we've tracked the same participants. In terms of data collection then, I said every 2 years. The first wave of data collection took place between 2009 and 2011. We have a computer-assisted survey questionnaire, also a self-completion questionnaire, which we use to collect information on more sensitive topics. And importantly, every second wave, we have a health assessment where participants come to a health centre to be assessed by a trained nurse. Now, for people in this room who might be interested in drawing on this data source in the future, importantly at wave 6, we're going to include a booster sample, because naturally as our sample ages, we have fewer and fewer middle-aged participants. So at wave 6, which should be happening in 2020, the intention is to recruit again at that younger age group. So we continue to have that longer kind of life course period that we can study. Very briefly then, the sample design, so it's a multi-stage sample design, and where basically geographic clusters were selected, and then within those clusters participants were randomly selected. For the middle-aged group, we have just over 3,000 participants at wave 1. And luckily, I'm not contradicting anything Brendan presented from the CSO, but we have, this represents, our sample consists of 40% are aged between 50 and 59, which is similar to that in the general population. So it is a representative of the wider population, with the caveat that these are community dwelling adults. So they tend to be somewhat healthier, if you like, because we don't include people who are in homes or in health settings. So who are the middle-aged participants in TILDA? So on the left-hand side I show the full TILDA sample, and then on the right-hand side the middle-aged only. And again, as Brendan has already pointed to, the middle-aged group tend to be more highly educated than the younger age group. They still tend to be employed, so you see much higher employment rate among this age group, although we do have 7% who have retired before the age of 59. And other than that, there's very little difference between this middle-aged group and the wider population. Okay, so as I said, I'm going to look very briefly at two aspects of social participation, so one formal, one informal. So in terms of formal then, I will look at volunteering, and basically participants are asked if they do any voluntary work, and if so, then how often they do it. So overall then we see that almost 50% of men in the TILDA sample do some voluntary work, so that will range from weekly to a couple of times a year. And here I'm comparing the different age groups, and I think the key point from this, I suppose, apart from the overall comparatively high rates of volunteering among this sample, is there's really very little change in the rates of volunteering between the 50 to 59 and somewhat older age groups before we see a drop off in the oldest old, which I've grouped here as the over 80s. And I point to this because we see this in a range of topics. A lot of the patterns of behaviour and so on that are established or brought into middle age, people bring forward into older age as well. So, coming at it from an ageing perspective, it's a key time where people, get the habits that will help them to lead successful, long lives. Okay, so now in terms of the frequency of volunteering, so we find that the frequency of volunteering is quite similar between the groups, with somewhere around 16% of middle-aged volunteering at least once a week. That doesn't change significantly until post-retirement. There's a slight uptake. What's interesting about this is the overall numbers of people volunteering doesn't change particularly much post-retirement, but frequency does. So again, this seems to point to a phenomenon whereby people who volunteer even during their working life and so on volunteer more post-retirement, whereas those who haven't volunteered up to that point don't necessarily take up extra volunteering activity post-retirement. I'm going to show you for both of the types of social participation just some differences and similarities according to age, location and employment status. So as with many of these types of things, we see a clear education gradient. So volunteering rates, or the percentage of people volunteering, is much higher among those with third level education. And I think an important point to make about that is volunteering is very good for the individual and also for those for whom benefit from their volunteering work. And this would suggest that there's a large untapped group of middle-aged men. And just to clarify now, this is limited to the 50 to 59-year-olds. There's quite a large group of untapped men with lower levels of education who, for whatever reasons, aren't as active in this domain as others. In terms of employment status, there's not a huge difference between the groups. So it's not necessarily that those with more time in their hands, who've retired early or whatever, are more likely to volunteer than others. And then in terms of location, we find a slightly higher rates of volunteering in rural locations. Now, in terms of the benefits of volunteering, I'm going to just very briefly look at quality of life, depressive symptoms, and self-rated health. I'll just grab some water, actually. Now, before I do, just to say about quality of life, and this is based on a measure called CASP-19. Quality of life, and this has been replicated in the UK and elsewhere. What we find is that quality of life continues, upward trajectory continues to improve from the 50s onwards and peaks around the age of 68 before we see a decline. And the main drivers of this decline are, there are some health features, particularly functional limitations, but the main drivers are social factors. It's about our relationships and the quality of our relationships and our connectedness with communities and family around us. So on the top here we'll see the average scores for quality of life. They vary between those who volunteer and those who don't. So those who volunteer have higher quality of life scores, and they also report fewer depressive symptoms. Now, we can't completely ignore the possibility of reverse causation here, where it may be that for many that volunteering improves their quality of life, but it may similarly be the case that those who already have poor quality of life or mental health problems, for example, are less likely to volunteer themselves. In terms of self-rated health, again, we find that those who volunteer are more likely to report their self-rated health as excellent or very good. Okay, so moving on to weekly active and social participation. So TILDA collects a lot of information on this area, and I've selected 6 items here, or types of activities. So from going to films and plays, playing cards, eating out of the house, attends classes and lectures, going to the pub, and participating in sports and exercise. So these are kind of the more social activities as opposed to maybe going for a walk or reading books and so on. So we find the most 2 popular things among this age cohort are participating in sports or exercise, and also going to the pub. Now, we can argue at lunch whether that's a good or a bad thing, but that's where they go. In terms of age differences then, again, we see there's a slight, very small drop in the numbers who do these activities as they age, and then we see that steep fall off again in the over 80s group. There is a education gradient again, although not as steep as the one we saw for volunteering, but again, those with higher levels of education tend to be more active. And you might remember for volunteering, we saw that it was middle-aged men in rural areas who were more likely to volunteer. For social participation, it's actually, that's important. For social participation, it is those living in more urban centres. So there's something going on there, whether it's just about access to the types of activities middle-aged men undertake, or possibly something else. Again, we find higher levels of higher quality of life among those who are more active, fewer depressive symptoms, and better self-rated health. Okay? So I've just picked 3 kind of outcomes here, but across the board we find positive effects of participation, including on biological outcomes and health measures. Okay, in terms of change over time, so I think we've kind of somewhat pointed to, we're looking at the different cohorts. As I said, for today we're limited to 3 time points for the first 3 waves. So in terms of volunteering, we see a slight decrease, although it's not quite statistically significant. So this is following the same group of men. So, those who were 50 in wave 1 were then 52 in wave 2, and so on. And we see a similar pattern in terms of social participation, and slightly stronger than that of volunteering, where participation rates seem to be increasing. So overall then we've pretty high rates of volunteering and participation. There is some social patterning. Okay? It appears those with lower levels of education are less likely to benefit from these activities, and both volunteering and social participation have clear benefits for our health, whatever way you look at it, in terms of physical health, mental health, overall quality of life. Just to finish up, I want to point out that this is a very, very narrow part of men and the general population's levels of participation. There's a whole raft of ways in which middle-aged and older men contribute to their communities and their families, and also benefit from the contributions of others. And if you're interested in following that up, we launched a report at the end of 2016 which really pulls that out. Into the future, as I flagged earlier at the start of my talk, later this year we're going to be looking in far more detail at social participation among this group, and in particular what we're interested in is seeing if the patterns or likelihood of participation changes as middle-aged men head towards that age of retirement, and indeed how they might change post retirement. I think the organisers are going to make slides available to people, so I'll just flag, I have some resources there. The TILDA data is available for people to analyse themselves from the Irish Social Science Data Archive in UCD, and also today we're part of a family of longitudinal studies across the world, and a lot of effort has gone in to make sure that that these have been harmonised. So we ask the same questions as in other countries. One of the great strengths of that, you can really start to see how different policies in different countries might impact on social participation and indeed health outcomes for middle-aged men and older. So thank you.